Hello, my name is Gawron, and I'm an obstetrician gynecologist at the Salt Lake City VA. I'm here today to introduce you to the one key question. Reproductive age women veterans are the fastest growing VA eligible population. Now imagine you're a young woman veteran who's new to the VA. You're navigating primary care, mental health, the emergency department, and other subspecialists, all while trying to reestablish your life at home and maybe even considering starting your family. Each place you go in the VA outside of a women's clinic, you are a minority. The healthcare team may not ask about reproductive health needs and may not have the knowledge or comfort to address your questions about pregnancy planning or contraception use in the setting of your other health conditions. This is the reality of the current VA care model. It leads to frustrated veterans who feel their care is siloed, and it leads to access barriers to preventive healthcare services. To address these issues without overwhelming our already busy providers, I proposed piloting a reproductive screening tool that is novel within the VA, the one key question. This tool, developed by the Oregon Foundation for Reproductive Health, prompts providers to ask every woman, every time, whether she is considering a pregnancy in the next year. If not, it reminds them to ask about contraception and either address their questions themselves or refer to a provider who can. If the woman desires pregnancy or if they are ambivalent about it, the tool prompts preconception counseling in order to optimize health and reduce risks of adverse pregnancy outcomes. To date, I partnered with a maternal health coordinator from our local health department to lead a discussion with our women's clinic staff about integrating the one key question into our setting. We received valuable insight on the current practice variability and comfort around these issues. Next week, I will lead an educational session at the primary care providers meeting. Then we will pilot a one key question patient survey tool that will be completed by reproductive age women while they're sitting in the primary care waiting room and then reviewed by their provider at the visit. I completed a pre-intervention chart review on all primary care visits over 1 month to describe baseline preconception or contraception documentation or referrals, and I will repeat this post-intervention to assess changes. We will invite provider feedback and plan for a more sustainable process within primary care in anticipation of future expansion to other settings, such as mental health. This innovation will give providers a tool to improve their comfort and knowledge of pregnancy risk screening. It will integrate reproductive discussions into non-women's health settings in order to address veteran concerns. Through more education and warm handoffs, we can partner with our veterans to improve reproductive planning and mitigate adverse pregnancy risks.